Sydney Freeston knows it's a bit late to start decorating the tree, but this year she just hasn't had the strength to do it.
Since the end of October, there has barely been a day in which all 4 of the people in my household have been healthy.
Freeston, her husband, and kids all battling a slew of illnesses from colds to strep throat, even COVID-19.
We're 5 days out from Christmas, and we are nowhere near where we normally are at this time.
Health Canada says cases of respiratory illnesses have been on the rise since mid-November nationwide. In Quebec, transmission is showing no signs of slowing down.
The situation over the next few weeks will deteriorate. Let's be clear about that.
Those without urgent illness asked to stay away from emergency rooms as many operate above capacity.
We need all the hospitals to be taking away all the pressure from the emergency. When we reach 200%, we know it's not safe.
Other provinces like BC and Ontario say they are faring better, but aren't immune to health worker shortages.
This is unheard of for emergency doctors to call in sick.
About 22,000 people of the couple of 100,000 who work in the healthcare system who missed at least one day last week.
And with COVID added to annual cold and flu seasons, medical experts say these intense waves of sickness may be the new normal. And annual flu shots and COVID boosters are more important than ever.
We have to have surveillance that shows us what the burden of respiratory infections actually is in our communities, and we have to be able to make individual but also collective decisions.
Health officials say those decisions can be as simple as masking up or sanitizing your hands. But most importantly, if you are sick, just stay home. John Hernandez, CBC News, Vancouver.